Hey guys, it's Angela here from Angela Marciano Physical Therapy, and I'm so excited to be joined today by Cassie McCarthy from Salem, Massachusetts. And Cassie, tell us a little bit about yourself and your practice.
Yeah, absolutely. So my name is Cassie McCarthy. As Angela just said, we're not related, even though we have the same last name. I'm a licensed independent clinical social worker. So what that kind of means is basically I'm a therapist. But in my private practice, I really hone in on and specialize in working with women who've experienced violence or trauma in their past. A lot of my clients have experienced sexual violence, relationship violence, or violence in their childhood. So that can look like physical abuse, sexual abuse, emotional abuse, or neglect. So my practice really revolves around helping women who are pretty high functioning professional women who've been impacted by their past learn how to kind of take back the way their brain is processing information
Yeah.
so that they can live to their optimal self because their past memories are kind of interfering in what's going on for them today.
And that's an interesting, we were talking a little bit about this the
Mhm.
other day, how in PTSD, it really is not just a matter of, well, just quit doing that. Like your brain really gets
Right.
rewired, right? And I don't
Yes.
think a lot of people understand that.
Right. I think most people, first of all, think PTSD is for like veterans. They
Yeah,
don't realize that
right.
that it's not just for veterans. That's not the only population that can be impacted by PTSD. The way I look at PTSD is that prior to the event, there was kind of like an order to your world, right? It's
Yeah,
called post traumatic stress disorder.
yeah,
So prior to the trauma, you had a way of organizing things, a way of making sense of things, a way of kind of going about things. And then the trauma happened and it disrupted your order. It disrupted your way of making sense of things, your way of coping with things, your way of processing things. And that really can have neurological impacts on your brain.
yeah.
When we go through a trauma, our brain just kind of takes over to protect us. And we go into what's called fight or flight mode,
Mhm.
and that really releases a lot of chemicals through our brain and through our body. And if we don't know how, if we don't have the skills or ability to turn off fight or flight, we can stay in that state for a really long period of time, years, decades,
Years.
even
Yeah.
years. And that's why I really want to contact you, was because if someone's living in that state, it's
Mhm.
going to have physiological
Yeah,
ramifications too.
yeah.
Yes, it's not just an emotional thing. It is a physical thing as well. And so there really is a huge component of the brain, of the emotions, of the body. It all connects together with trauma.
Mhm.
And so it was really important for me to kind of get the word out there that anyone can experience PTSD,
Yeah.
because most people will experience a traumatic event in their life.
Yes.
Trauma is anything that can be overwhelming to us, but really what it specifically means in this case is actual or threatened injury or violation.
Mhm.
So a lot of people will experience one form of it or another in their lifetime, whether it's a car accident or an assault, or I think in your field you probably hear a lot about birth trauma,
Yeah,
things of that nature.
yes.
So it is a fairly common experience.
And I think that's another important sort of, what is trauma? It's whatever is traumatic to you. And so
Mhm.
what's traumatic to me, you might be in
Mhm.
the same experience and it may not be traumatic.
Right.
Like it's in the eye of the experiencer.
Right. Right. So there's trauma and then there's traumatic stress. Right.
Mhm.
So trauma is an event that overwhelms our ability to cope.
Yeah.
So a lot of people will experience trauma. It might not necessarily be traumatic stress. So
Yeah.
when it becomes traumatic stress, it also involves threatened or actual violation or injury.
Yeah.
And that's when it kind of enters into what could possibly lead to PTSD.
Mhm.
Um, but a lot of times people will experience other form of traumas that still holds in their body, and it can be very stressful, and it can manifest in depression or anxiety or feeling overwhelmed or insomnia, and it can show up in a lot of ways.
Mhm, mhm. And we see that, in physical therapy. I know I've seen clients with whether it's back pain or pelvic floor issues or neck issues that it's just not responding to
Right,
physical
right,
treatment.
right.
The person is sort of doing all the things. They're going to a good provider. They're getting good focused
Yep,
one-on-one care. They're doing their stuff at home and it's just not responding.
sure.
And there's sometimes this other component, which is really nice if we can catch it sooner, which in physical therapy, a lot of times we have the time to ask a lot of questions. And so
Yep,
things may come up
yeah.
that sort of tip us off that there may be a little more going on than solely that physical piece,
Mhm, mhm.
but
Right, right. What I say to people is having PTSD is a lot like putting your car in neutral and then slamming the gas pedal for a decade.
yeah,
It's going to have some wear and tear on your body. It's going to have some wear and tear because fight or flight is your heart pumping. It is your body sweating. It is your blood flowing very rapidly.
yes.
Your whole system is on heightened alert.
Mhm,
And
mhm.
what also happens that people don't realize is the rest of their body kind of goes into like a battery saver mode.
Yeah,
Like when your phone has low battery, it turns off your ability to do other
yeah,
things on the phone. So when you're in fight or flight, you go into almost like a battery saver mode. You don't need to rest or digest. So people will have a lot of GI
yes,
issues. People will experience incontinence. It's a very common part of trauma because if you're running from a bear and you're carrying urine, your body needs to release it so you can run
yeah,
faster, or just because that's not necessary to survival
right,
anymore.
right,
And it could, but also things like just remembering things that's not necessary in fight or flight. You just need to
right.
get out of there.
That was the thing I was telling you. I was just speaking to someone who's a pediatric PT, and she's like, "You can't learn when you're on the run."
You can't.
That's,
No, no,
yeah,
you can't access that region of the brain. It's like physiologically impossible. The
yeah,
fight or flight region will do an override to the rest of your brain because it's just saying, I need to preserve myself. Everything else is not necessary right now.
yes. Yeah,
So it can have a lot of like impacts on like concentration,
mhm,
organizing your daily life,
mm,
staying focused, long-term planning, feeling
yeah,
joy, feeling gratified, feeling in the moment. Those things
right,
of your parts of your brain kind of get shut down.
yeah, yeah, yeah. That's fascinating, and that's such a good. I feel like that's such a good explanation for people who don't really understand, like,
Yeah.
what are how do all these other things fit in, and there's a lot of other things that could
Hmm.
fit in with this pattern. Um, and you had told me the other day, we talked about there are three evidence-based treatments for PTSD because you see a
Yes.
lot of stuff out there in the world, and it's like, okay,
Sure.
what's credible, what's valid, what's
Yeah.
reliable,
What's real, right? Like
what's
Google has all
real,
sorts of
right? Yeah,
answers.
yeah. Can you tell us a little more about that?
Yeah, absolutely. So to take a step back in the field of therapy, there's kind of like two main domains here.
Mm,
So first, it's the trauma informed care domain, and then it's the trauma focused care. So trauma informed care basically means the therapist is informed about what trauma is. They have an understanding of it, they know how it impacts you, they understand how it impacts your daily life, and they can be really thoughtful, sensitive, and understanding of it. 70% of the time when someone experiences trauma, with time, within about a month, we should say, it might naturally begin to resolve. But if you have some lingering things, but it doesn't meet PTSD level, a trauma informed care therapist would be perfectly fine.
aha.
But let's say after a month, you're still really struggling. Let's say you're thinking about the event a lot. Let's say you're having bad dreams about it. Let's say you're feeling on edge quite a bit. You can't focus, or you're going out of your way to avoid thinking about it. So you hyperfunction. That becomes,
Yeah.
it's a very common thing I see is over functioning. That's when you might want to think about, is this PTSD? To be diagnosed with PTSD, you have to meet with a licensed therapist, first of all, to be diagnosed. And secondly, ideally, they would administer a standardized test with you to look at your symptoms. But if you are exhibiting PTSD symptoms, and we can go over those in a minute,
Yes. Yes.
there are really only three recognized approaches for the treatment of it.
Mhm.
Those include what's called EMDR. A lot of people have heard of EMDR. Sometimes people think that EMDR is the therapy for PTSD because it's kind of famous.
Yeah.
And it's a great form of therapy. It does wonderful things, but it's one of the options.
Mhm.
Another option is called prolonged exposure therapy. The third option is called cognitive processing therapy. And I do cognitive processing therapy.
Mhm.
Um, so EMDR and prolonged exposure are both pretty much forms of exposure therapy. So people, when they think of exposure therapy, they often think of like phobias. So like if you're afraid of bridges,
Yes.
exposure therapy is when the therapist will like make you say the word bridge, and then they'll show you a picture of a bridge, and then you'll watch a video of the bridge, right? Like that's exposure therapy until you can gradually be exposed to the stimuli that's causing you distress without experiencing the
Yes.
distress.
Okay.
So with PTSD, there is kind of like five main areas of symptoms. And one of those areas is called avoidance.
Hmm.
You go out of your way to not think about the event, to not experience any triggers related to the event, to not ever have anything kind of be reminiscent of it whatsoever.
Yeah.
So with EMDR, what's happening is the therapist is using what they call bilateral stimulation, which is basically fancy terms for making you use the same region of your brain that's activated during REM sleep. So I
Okay.
don't know if you've ever watched someone sleep and they're
Mhm.
dreaming, you kind of see their eyes
Right.
going back and forth.
Yeah.
That's REM sleep, rapid eye movement.
Hmm.
And what's happening in REM sleep is basically your brain is taking all the stuff it's learned throughout the day and is putting it into its long-term memory.
Yeah.
So the EMDR therapist will elicit that same region of the brain because your trauma is stored in the long-term memory. So they open the trauma up through opening up that area of the brain, having you talk about the trauma while also having you pair it with a positive emotion so that the reminiscence of the trauma is not so negatively emotionally laden, and it can have a positive, more positive association. Now
Okay.
that is a very like rough definition
Yeah.
of EMDR.
Right.
I'm not an EMDR therapist, but there's great videos on it if people want to look into the National Center for PTSD's website. It's administered by the VA, and even though we said that not, you can have trauma without being a veteran, that's really kind of a great website for resources.
Yeah.
But that's kind of the nitty gritty of EMDR.
Mhm.
Prolonged exposure is also tackling avoidance, but without the more positive feeling being associated with it.
Yeah.
Prolonged exposure has you uh, expose yourself, deal with the things you're avoiding, so
Mhm.
that you can learn that you can tolerate the feelings without the avoidance seeking behavior, and so that eventually the things that you associate with being scared, the fear will subside after a while.
Okay.
So that's prolonged exposure, kind of like in a
I
small
know.
nutshell.
Mhm.
Yeah. And then there's cognitive processing therapy, also called CPT, which is what I do. And what CPT says is, if we think about it in the context that 70% of the time someone will naturally recover from trauma, then PTSD is a condition of non recovery.
Yes.
And we look at the places where they got stuck on their recovery journey. And
Yeah.
we call those places their stuck points. Those are the points in which they're being stuck.
Okay.
When we look at the stuck points, a stuck point, by definition, is anything you're believing about the event that's causing a negative emotion that won't go away easily.
Yes.
So we find the stuck points, which really are the beliefs of the event, how they're processing the event, how they're making sense of the event, but not just about the event, but about themselves in the context of the event,
Yeah.
the world in the context of the event, other people in the context of the event. And those beliefs almost become like templates where all new information after the event gets filtered through that template. So if they made sense of the event in a particular way and that becomes a template, new information gets put through that template. So if someone says something along the lines of, it happened because I didn't stop it,
Yes.
they might begin to think about all the ways that they can kind of better protect themselves in the future through exerting control. And that person might have a lot of controlling behaviors, whether they realize it or not. They might become hyper scheduled. So everything in their daily life is super predictable. They
Yeah.
might need to know every little detail of what's going on with their children that day, who they were around, what they were doing, what was going on, beyond just, standard parenting oversight, right? It
Right.
becomes kind of like a hyper focus on it, a hyper control of it, because they're processing things as, I failed myself.
Yes.
I let this happen and I will never let it happen again. This
Yes.
will never happen on my watch again.
Yeah.
And so they kind of like over function in a way.
Yes.
And so that's how new information begins to get processed, is through kind of an old template. And so
Mhm.
at CPT, we help them discover what those stuck points are, what those old templates are, and we kind of like break them down and we talk about in
Yeah.
what ways is this a limiting template? How do we expand it while also helping you remain safe? We
Yes.
don't want to abandon a person's fight or flight response.
Right.
We want to we want them to have control over it more.
Yes.
So if someone doesn't have any fight or flight, they're not going to look both ways when they cross the street.
Right. It serves a purpose.
Right, but we don't want them to constantly live in fight or flight.
Yes.
And so once they're able to decide when they're going to turn off fight or flight, how they're going to turn it off, they begin to access the other regions of their brain.
Mhm.
That's when they can focus better. That's when they can concentrate more. That's when they can sleep at night better, because they've learned how to turn off the fight or flight, which allows them to turn on the other part of their brain, the
Yes.
prefrontal cortex, where recovery kind of lives. And so we do that through really thoughtful planning out of finding all their stuck points. We spend a lot of time finding them.
Yes.
Once we find them, we look at them in kind of like two categories. The first category we tackle with learning all the skills associated with the therapy. And once they've learned all the skills and they've kind of tackled that first category, we
Yes.
then pivot to the other half, which is how the trauma is affecting them today and how they perceiving their future.
Yes.
And we break that down into five main areas of life: safety, trust, power and control, esteem, and intimacy. And we look at all of these five major domains and we talk about how has that event affected your beliefs in those domains? What are you believing about yourself? What are you believing about other people? And we teach them how to take back those domains of their life
Ah,
in a
wow.
very like systematized way.
Yes. Yeah. And it does. It sounds like it's a very systematized and
Yep.
sort of thorough, very
Yes, it's
thorough.
very thorough. Yeah.
Mhm.
Yep. It's very homework based. One of the things that I really like about it is that this isn't a therapy I do to people. This is a therapy that I teach them, because the goal is for them to have these skills without me, for them to be able to use them, to do them without me there. I'm a big believer that if you have a bad day and you feel like you need to talk to me to feel better, I did my job wrong. If you have a bad day, I want you to have the skills to turn it around,
Right.
to take back that day, to take back that control. We want people to have the skills for the rest of their life to
Yeah.
be able to heal from this and to be okay from this.
Yes.
And we want people to feel in control of what's going on. I think one of the big parts of experiencing trauma is you lost control over what happened to you. You weren't in control of what happened to you,
Yeah.
and we want you to feel in control. But what people sometimes mistake as feeling in control is actually them trying to grab control, and
Yeah.
they can feel really chaotic while they're doing that. Really
Mhm.
feeling in control is actually very quiet, very calm of a feeling.
Yeah. Yeah.
It's an ease.
And I feel like I would like to circle back around as we talk about that. Um, when trauma happens, it's that feeling of not being in control, you've lost in
Hmm.
control, sort of circling back around. We talked a little bit before about birth trauma
Sure.
and how that, and I feel like especially this past year during the beginning phases of COVID
Yeah.
must have been a big impact for a lot of women and moms.
Yeah. Yeah. I mean, your your whole life is changing, your body is changing, everything about what you're going through is changing, and then all of a sudden the world was entirely upside down and unpredictable, and there
Yeah.
was very little control people
Yeah.
had over a lot of things. Even, just as simple as like their birth plan was no longer
Right.
something they could plan out.
Yeah. Yeah, yeah, yeah. So that I feel like that can be a big factor for moms. And you have tell me a little more about how you have sort of a program when you work with folks. How first of all does somebody usually end up with you or finding you? Are they usually referred to
Yeah.
a provider? Do people
It
search?
comes from people find me in all different
Mhm.
ways. Sometimes people have been seeing another therapist, and the other therapist is saying, I think that what you have is something more than I know how to treat. It really is a specialty.
Yes.
Treating PTSD is truly a specialty.
Yeah.
Um, there's plenty of therapists who can do the trauma informed work, but if you have intrusive like thoughts that you can't stop from happening.
Mhm.
If you're having memories that are so vivid, it feels like you're back there again. If
Yes.
you ever feel like you're disconnected from your own body,
Yes.
you do need a specialist to treat that. So oftentimes a generalist therapist might get to a point where they say, this is not just someone that needs trauma informed therapy.
Right.
This is someone that needs trauma focused therapy. And so they might come recommended from their ongoing therapist. In those situations, it's kind of like their therapist is like their PCP, and
Yes.
I become kind of a specialist in
Yes.
that regard.
Mhm.
And that is one way. Sometimes people just find me simply from like Psychology Today
Yeah.
or Therapy Den. I have a website. People find me from the website as well. So it's just www.cassiemccarthy.com. There's a ton of information on there. So people find me there. And just, from other providers, I really make it a big effort to reach out to PTs, to acupuncturists, and
Yeah.
because people are receiving services, and if if an acupuncturist or a PT does a release and a person has memory and experience,
Yeah.
it's important for them to be able to know who to send someone
Yeah.
to, and who to talk to
Huge.
about that.
It's huge. And I think that is I worked for many years in outpatient orthopedic clinics, and it's really, when you're in that system, it can be really hard to get out in the world and like find out who's out there, because we're
Right.
like go go go, a patient every 30
Yep.
minutes, clinics more, lots of documentation. And
Yes.
there's lots of times that we have folks who either need not what we are providing
Right.
or need something in addition to what we are providing.
Yes.
And generally, any healthcare professional, I would say, like, our goal is always to help folks get to where they need to be. And whether
Sure.
I'm part of the solution or sometimes I'm not part of the solution,
Yeah.
I want to know where to
Right.
send them. I think that's a challenge. That's
Yep.
a big challenge, is when you're like, okay,
Yeah.
I need something else, but I don't know what else, and I don't know what
Yeah.
else. So it's
Yeah.
really important.
A big kind of myth I come across is when people think that because I do what I do, I must have kind of like such a heavy heart at the end of the day,
Yeah.
that it must be so emotionally grueling and so
Yeah.
emotionally
Right.
taxing.
Right.
And I what I say to them is, when I was earlier in my career, before I really was specialized, before I was really skilled and trained in this, I would, because I would sit with someone and I wouldn't know how to help them.
Yes.
And I would know that they need a certain service or a certain level of care I'm unable to provide. And
Mhm.
that was hard.
That is very
Um,
hard.
that is very hard. But now that I know how to do this more in depth, I feel better. Or even if someone sees me and it's still outside of my wheelhouse, knowing who to connect them with would make me feel better. And
Mhm.
that's true for even back when I was earlier in my career. If I had someone that needed a higher specialty or someone who was more enhanced, being able to connect them to the right service always felt better, because you knew
Yeah.
you were getting someone closer to where they needed to be. It's just, even now, if someone contacts me and we figure out that CPT is not the best approach for
Yeah.
them,
Yeah.
I want to make sure I can get them connected with either, an EMDR therapist or
Right.
prolonged exposure therapist. It's really about making sure people get the help that they need, even if it's not with me, just as long as they're getting what they need.
And I think that's important for people to know, because I know, I would have clients who they'd come in and they'd say, how are things going? And when they like you, oh, it's great. It's maybe a little bit better. Like, they don't want to say that they're not moving forward when they're not,
Right.
but it's okay, because I would rather have,
Yeah.
somebody say, yeah, no, it's not really better. This isn't changing. I feel kind of stuck, and help them
Yeah.
find the right person and connect them to the right
Yep.
provider, because that is what we want. We want them to get better.
Right.
Like, yeah, I
Yep.
love it. There's nothing better than the feeling of really helping somebody,
Yeah.
feel
Yep.
better, feel good, have a great life. But we're generally totally okay with letting go. And I think sometimes clients don't know that.
Yes.
They have a sense of loyalty, right? And they're like, oh, but she's so nice. And
Well,
she's,
and they also feel like they're like breaking up with us, and
well,
I'm just like,
yeah, right. That's what I always talk. I call it the breakup. Sometimes we have to start seeing other people, and it's okay. We're
right, right. Yeah, no,
married.
and it's interesting because one thing that I often have a lot happen now is people graduate. And so, I'm just like, we're not breaking up. You're graduating. It would be weird if you kept going back to like your English class junior year. Like you move on, you graduate, you got to kind of do what's best for you.
Right.
And the way I've always looked at therapy is that they're the train and we're the station.
Yeah.
They'll pull up and they will unpack some bags, they will reload with fuel that they need, and then they have to move on to the next
Yes.
in their
Yeah.
life.
Keep moving.
They're the train, we're the station, and I want them to keep going, to
Yes.
keep rolling forward in their
Yeah.
life.
That's awesome. I love that. I love
Yeah.
that. When folks see you, do they need a referral from there? How does all that work? Do you
So
take
it can depend. If sometimes some insurances might require a referral.
Yeah.
I'm in the process of no longer kind of partnering with the insurance
Yeah.
company, so I'm leaving all insurance.
Mhm.
So once that process is done, it really becomes a person's decision if they want to
Yeah.
see me or not.
Yep.
While I'm still on insurance, most of the time they don't need a referral, but every once in a while the insurance company will say, "Oh, you need a referral from their PCP."
Yeah.
So it's kind of a complicated topic. It's if you want to use your insurance, you have to ask your insurance. If you don't
Yeah.
want to use your insurance, then it's a decision you get to make with your provider.
Yeah. That's great. That's great.
Yeah.
And you were telling me when we spoke earlier, you told me sort of how your you sort of have a real specific program.
Mhm.
Can you tell me a little bit more about how that program works with you?
Yeah. Yep. So the way CPT is designed is that on average it's around 12 sessions, and that's not including the intake. So the first appointment someone sees me, that's kind of just like a global getting to know you, understanding everything that's going on in your life,
First
all
date.
sorts of first date, exactly. Just kind of the big picture. Um the second appointment is more of an education appointment because, like, for example, if you had diabetes, you would need to understand insulin.
Right.
So on that second appointment, we do a lot of education about the brain, neuroscience, fight or flight, how all of that works, because it puts a lot of things in context for a
Yeah.
person.
Yeah.
So, for example, fight, flight, or freeze, when someone understands that if they go into freeze mode, they physiologically can't move. Like
Yeah.
it's physically impossible.
Yeah.
So how could you have fought off a perpetrator if your entire system shut you down?
Yeah.
Right? How could you have physiologically done that?
Right.
So that first session is really kind of more of an education appointment. After that, we spend about 5 sessions doing a big deep dive and figuring out all those stuck points
Hmm.
and learning skills and applying the skills to some of the stuck points.
Yeah.
And then after that, that's when we pivot to looking at those 5 main areas of
Yeah.
life with safety, trust, power, control, esteem, and intimacy. And then we do the final appointment where there's an activity we do that's kind of like a therapeutic before and after, if you will,
Yeah.
where we contrast an activity we did earlier in our therapy together with an activity we did later. Every session before the session, I send out a standardized assessment tool to
Hmm.
measure their symptoms. So
Hmm.
they know every week if they're getting better or not. So there's no question of, am I getting better? I don't
Yeah.
know. Are we getting traction? We have the data. We can see it right in front of us.
Yeah.
Um, Once their scores get to a certain level for 2 weeks in a row, we know that they've hit a recovery point in their journey.
Yeah.
And if they want to wrap up, we can wrap up. If they want to start condensing the sessions, we can start doing 2 sessions in one. So
Yeah.
sometimes people are seen for exactly 12 sessions, like the model is designed. Sometimes people are seen for a little bit less. And sometimes people still have a slightly higher score. And
Hmm.
we might tack on a couple sessions at the end
Yeah.
just to really get at those final points. The research has said that after 20 sessions, you've gotten what you're going to get from
Yeah.
it. So I don't really ever see people beyond 20 sessions,
Mhm.
just because I know that they've gotten everything I have to offer.
Yeah.
We know if they're getting traction because of those scores that we're doing. So it's not like I drag people out for the full 20 sessions. If
Yeah.
someone's not getting traction, I fine tune what we're doing. I kind of try to pivot a little bit. I look for something else that might be happening. Or I simply say, does this feel like the right fit for you? If it's
Yeah.
not, it's okay. Let's get you the right fit.
Yeah.
So people know pretty early on if this is a therapy that they want to keep with.
Yes. Right. If it's working for them. And
Right.
you also mentioned for those sort of typical 12 visits, sometimes it might be 12 weeks, or sometimes it might be
Yeah.
a condensed. Talk a
Yep.
little more about that.
Yeah, so that's a really interesting part of this kind of therapy is because it's so systematized. It's not like, I have to see you once a week for 12 weeks. If you want to come in once a day for 2 or 3 weeks, you can get the whole course of therapy in several weeks.
Yeah.
You have to still do the same number of homework assignments.
Yeah. Yeah.
So it's not like a shortcut. You're doing kind of like a week's worth of homework in a day.
Yes.
But you can get the full course of therapy in a shorter period of time. And the research on it is showing that that actually is producing slightly better
Oh,
outcomes.
wow. That's interesting. Yeah.
Yeah, yeah.
In
My guess is that it's because it's less time under tension.
Yes. Yeah.
That's my hypothesis, but I'm not testing that one. I do offer that kind of therapy. It is intense. It is a lot of work, but it's really cool to watch someone kind of
Yeah.
go through it and within a week be like, "Who? Wait, no,
Wow.
I don't."
Yeah.
Yeah,
Yeah.
yeah. It's kind of mind-boggling for them
Yeah.
to really wrap their head around it at times. And one of the things I find is usually somewhere around like sessions 8 or 9, people will begin to say like, is this real? Is this a fluke? Am I only feeling better because it's
Yeah.
just, like things in my life aren't stressful?
Yes. Yeah.
That's usually what, and I'll say, well, maybe things aren't feeling so stressful because you've gotten better at coping, because
Right.
you aren't carrying this weight anymore.
Right.
Um, and then there's often kind of the conversation of, well, can I do this without you? And so we have to do a whole kind of addressing of, you've been doing this without me. There's
Right.
168 hours in a week. You only see me for one of them. So
Yes.
you've been doing this without me.
Right.
So it is a pretty amazing transformation that you see people go through in a pretty rapid period of time.
Mhm. Wow. And
Yeah,
so you are strictly virtual visits,
correct.
right?
Yep. Yep.
And because of licensure, Massachusetts only,
Yes.
do folks or could folks, if somebody, say somebody was from somewhere else, because there's not a lot, did you have a number? There's not a lot of folks who are trained in what you do.
Yeah, I looked actually just the other day at the CPT roster for civilian providers.
Mm.
So CPT is big in the VA world and the
Yeah.
DoD world. In the
Okay.
civilian world, it wasn't. It's not as common because there's a lot of providers in the VA and the
Okay.
DoD. But when I looked at the roster the other day, internationally, there's about 1,050-ish.
Internationally.
Internationally, there's
Wow.
under 1,100 on the CPT roster
Wow. That's
internationally.
not even US. That's like the
Not even
whole
US, yeah.
planet Earth. Wow.
Yeah.
And so I'm far fewer, I'm sure, in the US. So if someone were to, or could
I
someone,
think it was internationally, don't quote me on that,
yeah,
but I'm
but
pretty sure.
even still, even 1100 in the US,
Right, right,
would be
right. Yeah,
a
there's not
country.
a ton.
Yeah.
Yeah, in Massachusetts, there was, I think, 21 listed the other day, and there
Yeah.
was, like, a couple people that were double listed.
Right.
So there's not a ton.
There's nothing. So if someone were from another state and maybe there's not a provider, or not a provider performing remote, or not with the focus like you are on women post trauma, because there is a difference. I'm sure
Yep.
you can see anybody and anyone,
Yeah,
see any provider who offers what you do, but there is definitely some nuances, I think.
there is.
Um,
Yes.
so if someone were to say, come to Massachusetts for a week and do 5 sessions, and then they maybe go back home, and then the next
Mhm.
whatever, or they could
Yeah.
do it in 3 weeks, potentially. Like, is
Yeah,
that
yeah.
something that people do or could do, or
In theory, they could do it. Yeah, absolutely. I think it's a little tricky with COVID right now to travel.
right, COVID world?
There's
Yeah,
COVID. But in theory, people can do it. There's this awesome This American Life podcast episode. I'm not sure if I
yeah,
shared it with you.
you did, and I haven't
Where,
watched it yet. And I want to share.
yeah, yeah, it's a great episode. I highly encourage people to watch it. It's called 10 Episodes, where
Yeah,
the journalist traveled to a therapist to be seen every day for 2 weeks, for 10 sessions.
yeah,
Um, so it's called, 10 sessions is the name of the episode, but that way of rolling out therapy is called massed therapy, MASSED. And I do offer it. It can be twice a week, 3 times a week, 4 times a week,
yeah,
to get the full 12 sessions. But also sometimes if we see what is called being an early responder to the therapy,
yeah,
where your scores are dropping fast
yeah.
or getting low enough, we can start condensing the modules even
Right.
faster. So someone might not need the full 12.
12.
So what
Yeah,
that woman had done was 10 sessions instead of 12 sessions.
yeah. Yeah.
And there's some early research about being able to cut it even shorter if someone has, maybe a single event trauma. So 12 sessions makes a lot of sense if someone's experienced numerous events.
Mhm.
But if it's a single event, we might be able to do it
Yeah.
in under 10.
Yeah. Wow.
Yeah, it's really amazing.
Wow. And so I'm thinking of all these other questions I have for you, but just a one sidebar question. So are there folks who specialize in this technique with kids, or is it?
So that's a really good question. So
Yeah.
CPT is for adults, but there is something called TFCBT, and
Uh-huh.
they're very similar, but TFCBT is for kids.
Yeah. Okay. Yeah, just curious, because it is sometimes like you see these things and women maybe have lived with stuff
Yep.
since childhood, and boy, wouldn't it be nice.
Well, if it's an adult who experienced childhood abuse, we do CPT.
Right, right,
But
which
if
is
it's a
great,
child,
but it's nice if
yeah.
we know that somebody young has had trauma, there are resources, so
Yes.
rather than waiting 10 or 20 years.
Right, right,
Like,
right. Yes. So TFCBT is an evidence-based approach to children
yes.
who
Okay,
experience trauma. If
fascinating.
you're now an adult and you want to address your childhood trauma, you would do CPT, EMDR, or PE.
Yeah, yeah. That's super interesting.
Yes.
Super interesting.
Yes.
This was so much fun, and I'd love to
Yes,
chat again sometime. I just feel like you
absolutely.
have such a wealth of information and a really nice way of breaking it down.
Thank you.
I really appreciate it, and I think
Yeah.
um, it's good to get information out there, right?
Yes. And I appreciate you kind of having a platform and allowing that information to be spread. So thank you so much.
Yeah, yeah. No, thank you. This was so much fun.
Yes.
And since we are nearby, I'm in Beverly, Mass. You're in Salem. Hopefully, once
Yes.
things settle down, we can meet up for a walk and a coffee
That
sometime.
would be lovely.
All right, Cassie.
All
Thank you
right.
so much.
Thank you. Bye.
Bye.